Okay, I'm live. You can hear that. Okay, go ahead and turn the camera just a little bit for me. There you go. Perfect. Awesome.
Good.
Okay, now go ahead and grab Travis.
Cool.
Okay. Hello. Hopefully this is on, going good.
So you don't need this one?
Can you hear me? Now you gotta go see if it's live. Should be good.
There we go.
My man, how are you, buddy?
Good.
All mic'd up? Yeah, go ahead and take it on the left side of here. Awesome. Okay, so make sure, go ahead and just tap your mic, see if it. Tina, is it? Make sure it's on. Really quickly. On there. Think it's there.
Yep. On.
Okay, cool. All right. My man, how are you?
Good.
Big day for you.
Big day. One of the bigger days of my life, for sure.
So this is just a conversation talking about what we're doing today, right? And it's kind of exciting because today's a big day for you. You've been thinking about doing a big change for a while. Tell me about it.
Yeah, I mean, this is something I've been thinking about, I mean, honestly, since I was a kid, about 10, 12 years old. I was super embarrassed of my smiles when I started to get kind of made fun of. Even when I had all of my teeth, I have on my right side here some crooked teeth and stuff, and I felt like that was the one point where the kids went after, of me and everything like that. So subconsciously growing up, it's just I might not be showing it now, but if I ever do laugh or smile, I usually have my head down, I'm covering my mouth and something like that, and it even making eye contact. It's having a conversation with somebody. If I make eye contact with them and their eyes come down to look at my mouth, I automatically disappear from the conversation and I'm elsewhere. And it's just not fun. But I'm super excited to get it done.
So what led you to how did you find us?
Like I said, I've been looking into it for a while. I pretty much after each tooth had fallen out or broken, I look into it each time, and just mostly YouTube videos and things like that, just to watch the procedure. And I honestly didn't think anybody in Utah did this. And this last one, my back rear molar, which is one of my last ones, is broken in half. And I just went through some more excruciating pain. And so I jumped on. I said, this is it. I've got to get something done. I'm not being able to eat anymore, pretty much, So going through YouTube videos and different things, and I stumbled upon your videos, and it was kind of funny because I was watching. I was like, man, this guy seems super relatable. It kind of looks like my age-ish. I was like, I wish he was in Utah. And then I found out you're in Utah, and in fact, like 3 blocks down the road from me. So really lucked out in that way. So yeah.
They say the sound needs to go up.
Sound needs to go up a little bit. Let's see here. Yeah. Well, we'll just try to talk as well as we can. I don't know how to get it to go up, but well, I'm really grateful you're here, and at the end of the day, you're the patient. You're the patient that I like to do this for, because you have a whole life ahead of you. We talked about how you have this awesome career. Tell me about your career a little bit. What do you do?
I'm an engineer at Lagoon Park here. So yeah, I definitely have a funner job than most engineers, I think. Designing bridges or Walmarts or something like that. I get to design roller coasters for a living, so it's fun.
That's so cool.
Yeah.
One of the things I really enjoyed is the first time we met was just being able to talk so freely with each other. everyone in my office commented that you looked like someone. You get this all the time.
Yeah.
You know, does everyone think he looks like Thor?
Yeah, not a bad thing. I get it a lot. It's really fun, but I get that ties in with it too, right? So like people are like, oh, you look like Thor, and then I go to smile, and I'm just all I can think about is my smile. I'm like, you know, it's good to look like that guy, but I know I don't have that kind of same smile, Hollywood smile and stuff. So that's one thing I'm looking forward to, kind of match it all up. So.
It's a really big decision, right? Making
Yeah.
you know, this decision is huge. Tell me, you know, the idea of taking out your teeth, does that scare you a little bit? What's your, and I know the answer to this, but I'm gonna ask you anyways. Tell me what's your biggest fear?
My biggest fear, honestly, is not the pain, not the teeth coming out, anything. It's the anesthesia. The anesthesia for me is something very foreign to me. I've never been under. It's just the concept of it, you know, being unconscious. And I'm not necessarily a control freak or anything like that. I just the thought of being in a coma essentially for, you know, however many hours and then just coming to, you know, just that's the only thing that weirds me out about it. But
yeah, some of those shows, those movies in Hollywood, they kind of can freak you out. It's like Jaws, right? Once you've watched Jaws,
you think sharks in the water everywhere you go. Yeah, for sure.
But you know, one of the reasons that makes us unique is that I used to do IV sedation for the longest time, meaning that I would actually give medication and I'd be the operator. But at a certain point in my career, I decided that it was just too stressful to for me to know that if I could give the patient the experience that you want, meaning you don't want to be awake, you want to feel the pain, you want to feel the injections, but also you just don't want to be conscious at all, but you want to live.
Right, yeah.
And for 5 or 6 years, I did IV sedation myself. And as people are out there looking to do the same procedure, a really good question is how is that? Because people use the word sedation versus anesthesia. There's a big difference between the two.
Right.
Sedation is something that a doctor can do and perform. An oral surgeon or a dentist like me, an implant surgeon, I can push medications. I can use Versed, midazolam, fentanyl, these different types of drugs, and keep you what's called into a conscious moderate sedation.
Mm-hmm.
But the key term is conscious,
Yeah.
meaning that patients don't like the idea of them being awake. Even though they may not remember it later on, in the moment, the anxiety can go really high.
Right.
And so a few years back, I made the decision to go and bring in a third-party anesthesiologist or a nurse anesthetist here in Utah. And I think it's a really smart decision. And I just help my patients see that, listen, I have the responsibility to give you teeth. This guy has a responsibility to make sure that you wake up and you are 100% the same person you went to sleep.
Right.
And you'll love Jake. Jake's going to be here. He may be setting up right now. But the great thing is that literally he's going to be in charge of making sure that you're getting the right amount of oxygen. Your fear is, you know, because there have been mistakes. You look at Joan Rivers, right? She was under anesthesia and they weren't paying attention to her oxygen saturation. And that's why one of the big complications is she passed away. But what I want to tell you this is that that's all Jake is doing today is literally watching your oxygen saturation, watching all the signs, how much blood you have in your whole system. He's watching your heartbeat, making sure that everything stays normal. You are the ideal patient because you look like Thor. And this is the unique thing is like all the girls out there are going to want to know you are out of the market, right? You're not on the market, right?
Yeah.
Okay, that's good. I know that because I was hoping you were going to say that because I meant sure. So the biggest decision, you mentioned a couple of things to me. I always ask this question is, because most people come to see me because one, they're looking at wanting to have more confidence. The second thing is they're wanting to be able to chew better. The third thing is more like the pain or inconvenience of teeth keep on breaking. If I was to say you had to pick one, what is the biggest one for you that is kind of provoking this? Is it the pain? Is it the ability to chew, or is it more just like having that confidence?
Man, it's hard to pick one. But if I did have to pick one, it would be the confidence and a smile, because I do laugh a lot, I do smile a lot, and it really sucks to have to like look down or wonder if somebody's looking at my teeth or what they're thinking. You know, pain I can deal with. it's, off and on every month, something, gets inflamed or something like that. But yeah, definitely having confidence in my smile and laugh. So,
Well, and that's why I really loved being able to do this. I haven't done this. It's been probably 2 years. But let me tell you something. You're unique because you're truthful.
yeah.
You could say, a lot of men will just say, I want to chew better. That's the manly thing to say.
Sure.
But I noticed that in you, that you're a heart guy. You speak from the heart, and I love that about you, and I appreciate that, because no matter, most women would look at you and men and go, this guy has everything. He looks great. He's very handsome. But this aspect in your mouth feels like, even though, like, because you do a very good job hiding it. You're like really, you're like an assassin when it comes to hiding that.
I know exactly where that line.
You know where that line's at. But for me as a dentist, I noticed the first time I saw you that there was times where your face would tense up a little bit, and it was totally unconscious, right?
Mhm.
And so tell me about that. Do you feel like that's one of the things, like at work, that you feel like, or in your relationships, that like it feels like that's? Tell me how it plays out.
It plays out like I just feel like I'm always hiding something. That's subconsciously, like, that's what I'm thinking all the time, right? So I constantly think I'm never showing my true self when it comes to, as happy as I could be, right? Or like I would purposely, even if I found something funny, I would not laugh or act like it wasn't funny or something like that. So I'm never being my true self with this. So
Man, that's hard to believe, because and I can't imagine what your confidence is going to be like and how much freer you're going to feel when we're done with this, because I really enjoy sitting here with you. These conversations I really started to reserve for patients that I really felt like I would enjoy having the conversation, because sometimes it can be really hard to do this, right?
Mm-hmm.
But I love that about you, and I'm really excited to be able to change that aspect of your life. Now, here in just a matter of an hour, we're going to head into surgery. Previously, let's talk about what you've done up to this point. You came in for a consultation, and we looked at your CT. We gave you some different options. You'd seen me on YouTube. You asked a lot of really great questions. Left, it was a big decision. You were trying to decide between top and bottom. You thought maybe you just do the top, but ultimately you chose to do both top and bottom. Tell me about that.
In reality, I needed work on top and bottom regardless. And initially, maybe for financial reasons, we were thinking just do the top for now, and then maybe come back in a year and do the bottom. But it's like, if I'm going to do both, might as well just get it over with now and do it all in one surgery rather than worry about two surgeries. Right. Or do some kind of corrective work, because even if I just got the tops, I would have had to do some corrective work on the bottom anyways, and so that might have been a waste of money in a way. So because those would just eventually come out anyway. So
right.
Yeah.
Now we went through post-op and pre-op instructions. We gave you a big bunch of consents to sign. I was actually surprised you came back and didn't have very many questions. But looking at this overall process, again, you're at the beginning of it. And today's the big day of surgery. So for those who don't know, we're going to take out the rest of his teeth. He's going to go about 24 hours without teeth, maybe just a little bit more than 24 hours. Tomorrow afternoon, we should be going live and showing an after. It's going to be pretty awesome. That's a little nerve-wracking. You mentioned like you have a little baby. It's like I'm going to be like a little baby for a day.
Yeah, I thought about if there's a way, if I have to switch out the gauze or something, get a quick picture of me and him with the same amount of teeth or something. Yeah, try to find some humor in it anyway.
But the nice thing is that today is going to be like a nice rest day. You're gonna all it takes is the courage to let Jake just put an IV in you. Once he has the IV in, he's gonna give you a little bit of medication. You're gonna drift off. As you drift off, literally, next thing you know, you're waking up. And when you wake up, you will feel like your face is just numb, right? You'll be a bit loopy. But the nice thing, the drugs that we give also, and when I say we, meaning Jake, or elite anesthesia, or the group we use, they use a really great cocktail that keeps the patient very safe and sedated under anesthesia. But what's great is that you're not going to be so hungover the rest of the night. You should be able to go home and you'll be awake, and you shouldn't have a lot of nausea. You should be able to walk. Your wife's not going to have to carry you around. Do you have any questions about that at all?
No, not necessarily. It seems kind of straightforward.
Awesome.
Yeah, so.
Okay, the big question I have is, you watch a lot of YouTube videos, and there's a lot out there. It can be really confusing, and I'm honored that you chose us. But I try to wait to ask this question and be authentic as you possibly can. If it's just because I'm in Utah, that's great. My question is, there's a lot of doctors do this, and why did you choose us versus someone else?
Well, first of all, yeah, no, you're not the only one in Utah that does it. There's a couple in southern Utah, I believe, and everything. But in doing my research, sure, it was convenient, but like I said, it seemed a lot more relatable, right? You're a younger guy and everything. I didn't want to go somewhere where I just felt like I was treated like another number or something like that. There's a place right down the road that I was going to do a consultation with the next day after we had ours. And I knew immediately after that consult, I was like, I don't even need to go.
And I was telling you, like, you should go and just see how it was. And you chose not to. But it's something I often tell people is, sometimes you meet, like when I met my wife, it's kind of like this, I use the same scenario, like getting married. Like, I knew she was the one. But some people have to date a few people before they feel comfortable. It's that law of contrast. Right. And so, a really confident doctor will say, go see a couple of doctors. Mm-hmm. And if you come back, you'll understand what we think makes us unique. Mm-hmm. And so what I think ultimately makes us different than most people is that, for one, we are a small office. We used to actually pretty big with a lot of employees. We've transitioned to a smaller office where Dr. Hendricks has a little bit more control over everything. And also, I enjoy it when I have more time with my patients. So typically I'm going to see 3 or 4 patients a day, sometimes 2 a day. Today, you'll be my only patient because you're in surgery. I'm all yours. Yeah. And a lot of other doctors, and even I did this for a time where I would have, even while I was in surgery, other patients coming in being seen by either other doctors or other staff members. But that to me was like my mind was split. Right. And I just didn't enjoy that. I enjoy this when I can put all my time into it. So one is that we're a small office. 2, we do all the work here. Now, there's a lot of office actually now, 10 years ago, it was really unique to have an in-house lab. What's different about me now is that I actually do the lab work. This is something I haven't really actually put out there much on YouTube.
That was actually one of the things that drew me to this as well. I knew you did everything in-house, and I thought that was cool, because if there's any like alterations or any changes that if I want to make it, you're the one doing it. You're not sending it off to another lab and it's weeks out, for a change or something like that. So I thought that was really cool.
And that's what I hated about when I had to send work out, or even when I had my own technicians, is even at being in my office, there was so much that I couldn't control. Yeah. When they're past a certain step, it's like you don't know that you're off until you're in the room putting it in. Now, because my hands are the only thing that touches this, we have a complete control, and the outcomes I think are incredible, and I enjoy it more. And so I think it's a benefit for the patient, benefit for Dr. H. I think my team sees that I'm happier and I love what I do more. And so, but I'm really excited to be able to get going today. We're probably just about 15 minutes out, but is he here yet? Is he ready?
I don't know.
Okay, well, I'm going to check and see. But tell me this: as you look at long term, from let's say the next 4 months, what do you understand is the most critical things that you can do to be successful with this?
Staying away from tearing any kind of food and any kind of grinding of my teeth. That soft diet. I've read over the list a number of times, and I seem to be okay with it because I can't really eat right now anyways because I have like 0 molars, so it's not really going to be too big of a change for me. So, and then plus the thought of actually having nice teeth and everything like that, I'll be fine. I'm not worried about the diet or anything. So,
well, and you're right, because there's you can't control everything in life. There's some things that we have to just believe that your body's healthy enough and that God has the chemistry that's better than either me or you can control. Right. But at the end of the day, you can control your diet, and there's one other thing you can control, that'd be just your hygiene.
Right.
And that comes down to us teaching you. So I'll take some responsibility on that, because if we don't do a good job teaching our patients how to clean this, then so hygiene comes down to using a water pick, a spin brush, and then sometimes a little bit of water bridge floss. And so those are kind of like the three different things. And then, so it's like the right tools, we want the right skill set, and ultimately it's the right habits. If we get you the right habits and we have the right skill sets and you have the right tools, I mean, I think it was the other day that was texting Megan asking, hey, is this the right, do I get the right stuff, or you're buying your equipment, right?
Yeah, I got it all taken care of, and I just want to make sure I got the stuff that you guys recommended. That way, when you do teach me, I'll have the same stuff.
Awesome.
So
Awesome. Well, yeah. So we'll basically you'll be healing for 4 months. We'll come back at that time. You will be a different changed man. You'll have a lot more confidence. But the great thing is that we only can go from there to better, because the temporary material is a composite material. It's for most people, they'll think that it's gorgeous, and I think that these teeth are your final teeth. That's I pride myself on that. But ultimately, it'll just be for a few months. Then we come back and then we ask the same questions again. What do you want to change in the smile? And hopefully we've gotten close. After our last conversation, we talked a little bit, took a bunch of videos. You were here for a long time as we were gathering all the data. But the great thing is then we will do another try-in to make sure that we nail that perfectly. And then at that point, we go directly into zirconia. And so the zirconia teeth have the best hygiene, because it's made out of essentially what feels like glass. You have teeth that are hard, so then you get back to chewing and eating the food you love. I don't want you to lose too much weight. We don't want you to lose that Thor look like, But do you have any questions about that at all?
Not really. Like I said, pretty much all of your videos, and then a lot of others too. And I get the gist of it all. So if I do have any questions, you guys answer pretty quick. So
awesome. Well, I appreciate you being willing to share your story. And this is kind of the beginning. I'll probably go live a little bit during surgery, just at for maybe a few minutes to kind of show an aspect. And then cool thing is tomorrow we'll kind of show you getting the teeth. So it'll be really cool. But this is game on. So we're going to get you back with the anesthesiologist and get the ball rolling. All righty.
All right.
Okay, my friend. And that. Okay.